Welcome to our section on Hartnup disease. Let's get started. Here's a list of the topics that we'll be discussing for this section. Let's begin with the introduction. Hartnup disease is an autosomal recessive congenital disorder. This results in a defective neutral amino acid transporter of the kidney and intestine. Recall from our step 1 biochem videos that tryptophan is a neutral amino acid. It is used to synthesize niacin, hence a deficiency of tryptophan can lead to nicotinamide deficiency. Now let's briefly illustrate the pathophysiology of Hartnup disease. So here we have an enterocyte, or a proximal renal tubular cell, and this is the luminal side. Now, neutral amino acids, such as tryptophan, are absorbed with the help of a sodium-dependent transporter. And in Hartnup disease, this transporter is defective, which leads to decreased tryptophan absorption from the kidneys and intestines. And since tryptophan is necessary for synthesis of niacin, in Hartnup disease, we can see niacin deficiency, which presents as pellagra. Patients often present with features of vitamin B3 deficiency, also known as pellagra. And these can be remembered as the 4 Ds, which are diarrhea, dermatitis, dementia, and death. The Kazel necklace is a typical dermatitis finding in patients with pellagra, and that presents as an erythematous pigmented rash around the sun-exposed parts of the neck. So it makes this necklace sort of appearance. Now, other features include glossitis, cerebellar ataxia, and psychiatric disturbances. Now, this is a typical picture of a Kazel necklace in a patient with pellagra due to vitamin B3 deficiency. Notice the hyperpigmented rash around the sun-exposed part of the neck, and that appears like a collar or necklace. The diagnosis of Hartnup disease can be made by detecting increased amounts of neutral amino acids on urine examination. In addition to urine examination, the presence of clinical features of vitamin B3 deficiency is also supportive of the diagnosis. Finally, let's discuss the treatment. Now, nicotinamide supplementation may be required in symptomatic cases, which is logical because if they're low on nicotinamide, then supplementing can be beneficial. And a diet high in protein content is necessary to balance the lost amino acids. Now let's wrap up with a board-style question. A 10-year-old boy is brought to the physician by his mother due to recent behavioral changes. He was academically successful at school, but 1 year ago his scores started to decline. The patient frequently forgets to do his homework. Yesterday, he could not remember the name of his pet. He has 7 bowel movements per day with thin, non-bloody stools. The physical exam reveals hyperpigmented hands and forearms and a hyperpigmented rash around his lower neck. His uncle has similar symptoms. His vital signs include a temperature of 37 degrees Celsius, a blood pressure of 100/80, a heart rate of 82, and a respiratory rate of 15 breaths per minute. Which of the following is most likely to be found in the urine of this patient? A. Neutral aminoaciduria. B. Dibasic aminoaciduria. C. Aminoaciduria, phosphaturia, and glucosuria, or D. Increased urinary niacin. So feel free to pause the video and take a moment to consider the question. So this patient has significant cognitive changes. For example, he forgot to do his homework and his scores are suddenly starting to decline. And what's more concerning is that he couldn't even remember the name of his pet. Now, all these findings could be related to cognitive impairment. Also, he has 7 bowel movements per day with thin, non-bloody stools, and that description is consistent with diarrhea. And finally, he has hyperpigmentation on those sun-exposed areas, like his hands and forearms, and especially in that neck distribution, making that necklace appearance. This is a classic dermatitis pattern characteristic of pellagra. In fact, this patient has 3 of those 4 Ds we talked about: dementia, diarrhea, and dermatitis. And the fact that he is 10 years old and his uncle has similar symptoms indicates the possibility of a genetic syndrome. And a genetic disease characterized by pellagra-like symptoms suggests Hartnup disease. And once again, Hartnup disease is an autosomal recessive defect of the neutral amino acid transporter in the small intestines and the kidneys. Now, therefore, these patients lose neutral amino acids such as tryptophan in the stool and urine. And that's why patients have neutral aminoaciduria on urinalysis. So, the correct answer is choice A. This is the slide reminding us of the urine examination findings in patients with Hartnup disease. So now let's discuss why the other options are incorrect. So option B, dibasic aminoaciduria is incorrect because it is seen in cystinuria rather than Hartnup disease. Now, option C is incorrect because aminoaciduria, phosphaturia, and glucosuria are seen in Fanconi syndrome rather than Hartnup disease. Finally, option D is incorrect because patients with Hartnup disease lose neutral amino acids. They don't actually lose niacin in the urine. And that concludes our lecture.